What we're here to discuss is psychosocial stress. And this was one of the first studies that were published in a large population base that said psychosocial stress is as important as having uncontrolled high blood pressure or being medically obese. Now, no one in this room or in the medical community would argue that hypertension and medical obesity are not problems for developing heart disease. But this was the first study that said psychosocial stress is something you need to pay attention to. And it was a very simple questionnaire. It asked the participants, do you feel stressed at home? Do you feel stressed at work? Do you have financial stress? Have you had a stressful life event in the last year? A death in your family, a divorce, a separation from loved ones, a health change, even if it's not for you, for your mother, for your father, for your daughter, for your son. Have you ever experienced depression? And most importantly, do you feel like you're on top of this? Or do you feel like it's controlling you? We all have life events, but where is your locus of control? And the other was that good stress was as important an impact as bad stress, i.e. planning for that wedding, planning for that 50th wedding anniversary, planning for that vacation that's maybe out of your reach financially, may in fact be as equally stressful in terms of your biochemistry. And what they saw here, again, was as you went up on the global stress scale, some stress, several stressors, permanent stress, and you lost your locus of control, your odds ratio went from no stress, totally in control, to 1, to over 3 when you had permanent stressors in your life and you felt like you were out of control. Depression, and you will hear more about this, I'm sure, later in the day. Again, if you felt depressed, and you had several stressors in your life, your risk of developing heart disease or your risk of having had a myocardial infarction was much, much greater than those individuals who were less stressed. So in 52 countries, the presence of psychosocial stress was associated with an increased risk of acute myocardial infarction, and it explained 32% of the time why people had a heart attack. Very, very powerful information. So, every morning, in my life, let the stress begin. Stress is the automatic, non-specific response of a human organism to any change or demand. It is a particular relationship between the person who's experiencing it, not your neighbor, not your husband, not your son or daughter, and that person's environment that is appraised by that individual as taxing or exceeding his or her own resources and endangering his or her well-being. It invokes the limbic system in our brains, the seat of our emotions. We auto-regulate our emotions via the hypothalamus, and we then send out messages via either hardwire through our spinal column and nerves connecting directly to our body's organs as to how they're going to respond, or our software where we're sending out little parcels of biochemical hormones that are produced in the brain, in the adrenal gland, in the pituitary gland, in the thyroid gland. And this is an automatic, autonomic response. We do not have significant control over that once it is activated. Acute stress is the threat. We perceive the stress as immediate, and we need to respond instantaneous. And that's that adrenaline surge. And those of us who are highly successful actually like to operate on that little bed of adrenaline because it lets us multitask and get a lot of things done. But with adrenaline becomes noradrenaline. And noradrenaline is actually something that's packaged intravenously to give people who are in shock to raise their blood pressure. So every time you get a hit of adrenaline, you are also getting a hit of noradrenaline, which constricts your blood vessels, constricts flow to your vital organs, and potentially over time can damage and cause cardiovascular disease. Chronic stress, you think that this threat is unabated, it's prolonged. It usually involves the secretion of another adrenal hormone called cortisol. So that alarm reaction, fight or flight. You feel tense, you feel muscle tension, you have strong emotions, either terror or anxiety, anger or rage. All of this is appropriate for survival, but if it goes on unrelentingly, it will cause harmful effects. It will increase your heart rate, and if you have any tendency for having heart disease, you are working too hard. Your blood pressure is inappropriately high for the kind of work you're doing. pushing the cart around in the grocery store, your blood pressure is 150/100, and you, over time, are straining your heart and causing problems. Digestive tract, you don't digest your food appropriately. You're constricting the blood supply there. You get an ulcer. You get gastroesophageal reflux disease. You have other symptoms that are telling you you're overstressed. Your pupils dilate. Your skin constricts. Your arms and your leg muscles get tight, because they're now engorged with blood, because you're supposed to fight the dragon or run away. And if you're just calmly sitting, or not so calmly, sitting at your computer and you don't have time, you end up with muscle tension across your back, across your neck, across your shoulders. It is necessary when survival is threatened. Chronic stress, you have to keep going. It's unrelenting. I can't get out of it. I know that next month, next year, things will be better because I'll be able to sell this business, because I'll be able to X. It is, again, it is reinforcement for the fight or flight response. It is cortisol, which is the hormone that's secreted to let you survive the 40 days in the desert. Some of you watch late night television, you see those commercials for Cortislim. Just take this and your pounds will melt away. It's a nice idea, but when you have excess cortisol, your body doesn't know when you're going to be fed next. So every single morsel that you take in, your body holds on to. And guess where it goes? Right here. Right here in your abdominal area, and that produces a tendency for prediabetes and diabetes long term. It also increases salt retention from the kidney. It causes secretions of hormones that retain salt. When you retain salt, you push against the walls of your blood pressure, which are already stiff, walls of your blood vessels, rather, which are already stiff because of the other adrenaline and noradrenaline you've got in your system, and your blood pressure goes up further. You increase your clotting factor. So if you have a sudden rupture in your coronary arteries, you don't necessarily dissolve that on your own. You completely clot, and you start having the heart attack process. And you increase your metabolism of fats, so you make more of the bad cholesterol and less of the good cholesterol. Now, what kinds of stresses are we prone to? And again, all of you are, I'm sure, aware of this. This is the Holmes and Ray's life event scale. How much change in 1 year does, in fact, relate to your health issues at later times? And they're ranked by adjustment. The death of a spouse or a child are number 1, followed by divorce, followed by personal injury or prolonged illness, followed by being fired or laid off. Death of a friend or a family, change in your work. Promotion is a good thing, but as we've learned, it's over in about 2 weeks. That thrill is gone, and then you're stuck with what you have to do to make it happen. Marriage, mortgage, moving, vacation can be stressful if you don't plan appropriately. Retirement, pregnancy, personal achievement, and even so much as a traffic ticket. The more you have, the more stress hormones you produce.